For the purpose of this presentation, we will be examining the disorder cerebral palsy, the possible causes, signs and symptoms, treatments, as well as how the disorder can be addressed within the early childhood education workforce.
Cerebral palsy is one of the most common congenital disorders of childhood. This means that it's a condition that is seen at birth or even before birth. This disorder is the result of a brain injury or a brain malformation. It affects muscle tone, movement, and motor skills, which means that people diagnosed with it lack the skills to move in a coordinated or purposeful way. Other actions involving muscle control that may be affected when having CP are breathing, bladder control, talking, or even simple actions such as standing still would be difficult for someone who has cerebral palsy. There are 3 types of cerebral palsy, and each one is different because a different part of the brain is affected. The 3 types are spastic, athetoid, and ataxic cerebral palsy. Spastic CP causes stiffness and movement difficulties. It occurs when there's a damage to the motor cortex and the pyramidal tracts of the brain. The motor cortex, which is in the cerebral cortex, is responsible for relaying signals to other parts of the brain to control movement. The pyramidal tracts are the roads of communication between the cortex and the nerves in the spinal cord. Athetoid or dyskinetic CP results from damage to basal ganglia, which are nuclei in the brain that are responsible for coordinating voluntary movement. And it also occurs from damage to the cerebellum, which is responsible for regulating coordination and precision of movements. This type of CP leads to involuntary and uncontrolled movements. Ataxic is caused from brain injury to the cerebellum before, during, or shortly after birth. The cerebellum is central to regulating balance and coordination commands from other parts of the brain and translating these signals to the central nervous system. Damage to the cerebellum causes a problem with balance and depth perception. It's also a possibility to have mixed cerebral palsy. This means that in the people with this condition, there would be injuries to multiple parts of the motor control centers, causing movement problems seen across the various types of the disorder. CP is chronic, so this means that anyone who's diagnosed with it will have this condition for the rest of their life. The brain will not heal as other parts of the body might, like a broken hand would. Due to this, the cerebral palsy will never change for better or for worse during the person's lifetime. How does CP affect child development? The degree of the child's disability depends on the extent of the damage to the brain. The damage can be very limited, affecting only a small part of the brain that, for example, controls only walking, or it can be much more widespread, affecting muscle control of the entire body. The damage to the brain that results in cerebral palsy can also affect other brain functions and lead to other medical issues. Some examples of the medical issues are visual impairment or blindness, hearing loss, speech problems, sleep disorders, osteoporosis, which means that the bones in the person's body are very weak and brittle, and different behavior problems. It also affects categories of development. These are gross motor skills, fine motor skills, sensory skills, language skills, and social and emotional development. Gross motor skills are needed to reach major milestones in early life, such as head control, crawling, sitting, and walking. When CP affects these skills, children diagnosed with it tend to reach their milestones later than their peers usually would. Children are also unable to develop their fine motor skills, which include holding a spoon or fork and picking up small objects between the thumb and their finger. Sensory skills are also affected by CP because children may struggle with processing information from the 5 senses. This usually is called sensory processing disorder, and children with this disorder may be hypersensitive and dislike being touched. They will usually get startled when they hear sounds, and they may seem unable to tolerate normal lighting. CP affects language skills. In order for children to develop the ability to speak, they need muscle strength in their mouth and tongue. This muscle strength is necessary for vocal sound control. Children with CP usually lack these skills, and this delays their ability to speak. A child who has trouble processing sensory input or who has poor movement because of damage to their brain will have delays in the following areas of social and emotional development. They would not be able to cry to express emotions like distress or crying for needed comfort. they'll have trouble fixating on a face and responding to their own name. And they will also have delays and troubles in playing social games with caregivers or families such as peekaboo.
Body movement begins within the frontal lobe of the brain, which consists of the primary motor cortex, supplementary motor cortex, and premotor cortex, as shown on the diagram here. The frontal lobe is the brain region responsible for motor function, along with the cerebellum that is involved in coordinating voluntary limb movement and maintaining overall muscle tone. The ability to use motor function begins when the dendrites of a neuron receives a coded signal, or nerve impulse, through receptors in response to a stimulus. The signal is then passed along the axon, this is known as action potential, and that gets to the effector or muscle cell to instruct a contraction, therefore activating muscle movement. For example, a child who gets burnt by touching a hot stove senses pain. This is the stimulus. It then signals the brain that that the child has touched a hot surface, and therefore causing that child to undergo muscle movement as they quickly move their hand away from the stove. People with cerebral palsy may not carry the ability to conduct certain movements due to the lack of effective neuron transmissions. This can be caused by brain injuries or malformations that begin developing, during the fetal stage, and some of these malformations and injuries can be caused by genetic or environmental factors, poor myelination of developing nerve cells, which assists in the transmission of brain information and signals, along with brain cell death due to deprived oxygen to the brain. In addition, brain damage can also be occurred postnatally due to rough handling of the baby during the birthing process.
So I'm going to be talking about what causes cerebral palsy. So cerebral palsy is caused by brain injury or brain malformation that occurs either before, during, or immediately after birth. That happens while the child's brain is still under development. Although how the brain injury affects the child's motor functioning and intellectual abilities is dependent on the nature of a brain injury, where the damage occurs, and exactly how severe it is. So every case of cerebral palsy is unique to each and every individual. This is due in part by the type of injury, the extent of the injury, and the timing of the injury to the developing brain. The brain damage that causes cerebral palsy is a result of one of these four things. So it's either prenatal disturbance of brain cell migration. So this happens when genetic and environmental factors disturb brain cell migration as cells move to their appropriate location during the brain development. So this happens during the pregnancy and is caused by genetic and environmental factors. The next one is prenatal poor myelination of developing nerve cell fibers. This is when brain function is impeded when poor myelin provides an inadequate protective covering over nerve cells that aid in the transmission. The next one is perinatal brain cell death. So this happens during birth, in events in the birthing process that rupture blood vessels or starve oxygen to the brain. Most likely when the child is born and there isn't any oxygen going into the brain, that's when it can occur. Although in most cases, brain injury leading to cerebral palsy occurs during pregnancy. That is the most common type. And the last one is postnatal, non-functional, or inappropriate connections between brain cells. So now, how do we diagnose cerebral palsy? Unfortunately, there is no one-step quick test that can be used to diagnose cerebral palsy. Unfortunately, it might not even be diagnosed until months or even years after the baby is born, unless it is a severe case in which that can be seen right away. But listed below, we do have 12 steps that are usually used or happen in order to diagnose cerebral palsy. So the first thing is parental observation. Usually the parent will notice signs that show developmental delay and impaired muscle tone, and abnormal signs, lack of milestones that kind of indicate a need to see a professional. So the next step would be clinical observation. The parents would then take the child in to see a pediatrician, which would do a checkup and, if needed, send them on to further analysis to either confirm or rule out cerebral palsy. The third step would be motor skill development analysis. Since cerebral palsy does affect motor control, the pediatrician will be evaluating the muscle tone, movement coordination and control, reflex regularity, posture, balance, fine motor function, gross motor function, and oromotor function. The evaluation of motor skills may help establish the type of impairment and degree of severity. The next step would be a medical history review. This would eliminate other possibilities and would help and aid in diagnosis of cerebral palsy. They'll want to know the child's prenatal history, as well as if there were any complications during labor or delivery. Step 5 is documenting associative conditions, co-mitigating factors, and ruling out other conditions. So the medical examination process can involve multiple doctors, tests, and appointments, and during this time, doctors will rule out other similar conditions, such as degenerative nervous disorders, genetic diseases, muscle diseases, metabolism disorders, nervous system tumors, coagulation disorders, or other injuries or disorders that may delay development. And from then on, you go to step 6, which is obtaining test. So after all the testing, you've gotten a diagnosis, and by then you know your child does have cerebral palsy. Some parents may seek out a second opinion to confirm the diagnosis and also rule out any possibility of misdiagnosis. Second opinions can also assist with any outstanding questions the parents may have, remove any possible doubt, and get a second opinion on any treatment options that the previous doctor may have provided. After that, we've got determining cause. So brain injury or brain malformation is the root of cerebral palsy, but there are 3 types of brain injury and form of brain malformation. It can be damage to the white matter of the brain tissue, it could be a brain hemorrhage, lack of oxygen to the brain, or brain malformation or abnormal brain development. Likely most parents do want to know a cause just to get rid of any doubts, and to help really settle in the news and know how to treat it. Step 10 is creating a care team assembly. A lot of parents choose to do this depending on the severity of the cerebral palsy. You may need extra support, extra caregivers, extra educators, so on and so forth. After that is step 11, which is care plan creation. A care plan tracks the child's treatment, including tests, diagnosis, and treatments received. This is important to establish and maintain a care plan that allows easy and efficient access to valuable information, and this will continue to benefit the child and help them out for their entire life. And finally, embracing life with cerebral palsy. Unfortunately, there is no cure for cerebral palsy. It's just something that the family needs to adapt to and learn to live with.
Individuals diagnosed with cerebral palsy can experience a lack of motor control, difficulties with coordination and balance, stiffer limb muscle tone, spastic movement, and slow reflexes, while attempting to use their fine and gross motor skills. The disorder can be recognized during infancy through their use of the pincer grasp, neck rotation, arm stretches, and leg kicking. Some early signs of cerebral palsy in infancy include delay in disappearance or exaggeration of a developmental reflex, such as one that causes a baby to straighten their legs and arms when looking up and folds limbs when their head goes down, which is strongly related to balance and muscle tone. Also, an increased or decreased use of muscle tone, poor head rotation, persistence or asymmetric hand fisting, and abnormal oral motor skills such as tongue thrusting or frequent grimacing can be used to determine possible signs of cerebral palsy. Although it can be detected in infancy, it is actually best recognized in children ages 3 to 5 years old when they're actually capable of using their entire body while talking, walking, running, jumping, and even engaging in simple tasks such as writing, grasping objects, or tying their shoes. Children who demonstrate difficulties or signs of exhaustion while conducting these everyday movements are actually at risk of being diagnosed with the disorder. Moreover, the severity of the disorder can vary from person to person, So therefore, every aspect of a child's movement should be observed to determine whether the child shows signs of cerebral palsy. For instance, a 5-year-old is observed waddling and dragging their leg while walking, while another child who is capable of walking displays difficulties firmly grasping onto a marker while drawing and inability to straighten their hands. In addition to difficulties with limb movement, many individuals with cerebral palsy will also experience difficulties with communication and oral movement due to the spastic movements of face muscles, affecting their ability to breathe, eat, close their mouths, and swallow. Overall, cerebral palsy can be detected through the examination of motor milestones and observations of daily body movement. Although cerebral palsy cannot actually be cured, the disorder can be supported and treated through the use of physiotherapy, orthotics, botulinum toxin injections, oral drugs, and surgical interventions like orthopedic or neurosurgical, depending on an individual's severity of the disorder. Specifically, medications provide temporary relief such as baclofen, which actually relaxes the muscle directly, and diazepam, which acts on brain chemistry. In addition to that, common anticholinergic medications are used to treat uncontrollable body movement, varying from muscle stiffness, tremors, and spasms, while stimulating the nervous system by blocking neurotransmitters to promote muscle movement. Moreover, non-drug physical therapy can enhance an individual with cerebral palsy to improve their functional abilities through specialized exercises and stretches, which can stimulate muscle training and strength, flexibility, balance joint mobility, and range of motion, along with reduce their muscle pain. Individuals experiencing cerebral palsy may also use adaptive equipment such as wheelchairs, braces to tighten their muscles, walkers, canes to improve muscle rigidity, orthotics, and even computer technology to assist in muscle improvement. Aside from physical therapy, the use of hyperbaric oxygen therapy, also known as HBOT, can be used to treat individuals with cerebral palsy while exposing them to pressurized oxygenated air to promote the recovery of damaged and inactive neurons. Surgery can also be used to straighten out bones or cut off nerve to reduce spasms. Now we're going to be discussing the importance of learning about these certain types of developmental issues such as cerebral palsy and how we can address these type of topics in an early childhood education professional classroom. So as an early childhood education professional, it is important to discuss and recognize possible conditions such as cerebral palsy before working with a child diagnosed with the disorder in order to gain a better understanding of how to successfully and comfortably deal with that particular child. In addition to that, educators are able to effectively handle a possible situation in which a child may have difficulties due to their condition. An educator knowledgeable on different disorders can develop specific activities to include the child with that particular disorder in classroom activities. For example, if child A, who is diagnosed with cerebral palsy, may not be able to run during outdoor playtime with his peers due to being in a wheelchair all the time, that can disrupt his ability to socially interact with his peers. So this can be solved if an educator is able to prepare other types of games, other types of activities to include that child despite their physical condition. Moreover, early childhood educators knowledgeable on cerebral palsy can educate their students by briefly describing the disorder and the cause of the disorder to ensure that the child does not feel that there is something wrong with them or that they're at the center of attention. This encourages peer support for the child who experiences cerebral palsy so that they feel involved and comfortable working in their classroom environment, which ensures optimal development. The early childhood education professional can also work alongside specialists on cerebral palsy or the child's therapist or aide to get to know the student more and think of alternative teaching strategies to accommodate to their strengths. The early childhood educator would also have to be patient when encouraging the student with cerebral palsy to perform a task or answer questions, since the delay with language skills and motor skills will affect their response time. Overall, the background knowledge obtained on various developmental disorders will help future early childhood educators to work better and more comfortably with children of distinct developmental issues. We'll now watch a short clip that gives us more insight on what life is like for children and adults living with cerebral palsy.
Cerebral palsy is an umbrella term for a group of disorders that affects a person's ability to move. This means that not everyone with cerebral palsy looks the same. There is a meaningful future for every child, adolescent and adult living with cerebral palsy. For every person, there is a positive way forward through treatment and support provided in partnership with individuals and their families. Cerebral palsy is caused by an injury to the brain that usually happens during pregnancy, but sometimes it may happen shortly after birth. Cerebral palsy affects people in different ways because different parts of the brain can be injured. However, it always has some impact on the person's movements, and this is because the messages coming from the brain to the muscles are affected. Cerebral palsy is the most common physical disability in childhood, with 1 in 500 children born in Australia each year. Cerebral palsy affects people in different ways, and this is largely due to the location of the injury in the brain. Therefore, cerebral palsy is described in a number of ways, including the parts of the body affected and the way in which it affects movement. Where the whole body is affected, that is, both arms and legs and the trunk, this is called quadriplegia. Where both legs are mainly affected, this is called diplegia. People with diplegia often also have difficulties with fine movements of their hands. When one side of the body is affected, for example the left arm and the left leg, this is called hemiplegia. The next way of describing cerebral palsy is to talk about the way it affects movement and the type of movement difficulties experienced by people with cerebral palsy. Spasticity is probably the most commonly known term. Spasticity is present in about 86% of people with cerebral palsy. It results in muscles that become stiff and tight, which can make it difficult for someone with spasticity to use their muscles easily. It is difficult for someone with spasticity to turn their muscles on and off when they want to. This makes it difficult for them to move their arm or leg to do a task, or to use their mouth and face muscles to eat and talk. Some people have a little bit of spasticity, other people have a lot. The impact of spasticity on movement will therefore vary enormously between individuals. You might also have heard the terms dystonia or athetosis. Dystonia and athetosis describe movements seen in dyskinetic forms of cerebral palsy. Dyskinetic or dyskinesia refers to movements that are involuntary. These involuntary movements can become more noticeable when a person tries to move or when they become excited, agitated or tired. Dystonia results in unusual twisting postures, repetitive movements or sometimes both. Dystonia can present in one part of the body, such as an arm or foot, or throughout the whole body. With athetosis, we see slow, continuous, involuntary writhing movements that are present at rest and made worse by attempts to move. Around 6% of people with cerebral palsy have dyskinesia, with dystonia more common than athetosis. One of the less common forms of cerebral palsy is ataxia. Ataxia means without order or incoordination. Ataxic movements are characterised by clumsiness, imprecision or instability. Movements are not smooth and may appear disorganised or jerky. The incoordination seen with ataxia occurs when a person attempts to perform voluntary movements such as walking or picking up objects. Ataxia causes an interruption of muscle control in the arms and legs, resulting in a lack of balance and coordination. Sometimes people have a mixed type of cerebral palsy. For example, some people have both spasticity and dystonia.
Before we end this presentation, we would like to review some questions. So, what is cerebral palsy? How can cerebral palsy be detected? And what are some ways to support individuals with cerebral palsy? So you can pause the video and take some time to answer these questions. With the right treatment and support system, children who develop cerebral palsy can achieve an overall optimal cognitive, physical, emotional, social, and language development. Thank you for listening.